Welcome to Motors in Medicine. On today's episode, I'm going to be discussing semaglutide and what it's used for, what its intentions were in the beginning, what it's being used for now from a commercial standpoint, how it can benefit anybody who starts using it, what the effects are, etc. So to start, what is semaglutide? Well, commercially, as you've probably seen in commercials, there's Ozempic and Wegovy. These are medications that were originally marketed for the purpose of diabetic control. So diabetics suffer from a number of issues, one of them being an issue with insulin production as well as insulin resistance. And so what this medication does is it helps diabetics to regulate their insulin a little bit better, and it also helps to achieve tighter glucose control. One of the side effects of these particular medications, which both of those compounds have the base of semaglutide. One of the side effects is weight loss, and this was what was discovered during the post-marketing surveillance of, and even prior to that when it was being tested, of these two drugs, Ozempic and Wegovy. So now, this medication is being marketed for weight loss. So let's first talk about what this classification of medication is, and then we'll talk about how it works. So this medication is classified as a GLP-1 agonist. And what that basically translates to is that it is a medication that targets the pancreas to, it basically upregulates the pancreas to release more insulin. And by doing so, that insulin will adhere to and allow glucose that's floating around in the bloodstream to be taken into the cells and be utilized more efficiently. The other part of how GLP-1 agonists work is one of their side effects is to block or inhibit the hormone glucagon. Now, first, glucagon is a hormone produced by the body. Its main purpose is to create a release of glucose that's stored from the muscles and the liver during the day when you're not eating. So when you're in between meals during the day, glucagon is a hormone that's released to create a steady stream of glucose in the bloodstream so that it can stimulate the muscles and the liver where glucose is stored in the form of glycogen. And it creates just right certain amount of balance of glucose floating around the bloodstream. And by doing so, you help to keep your cravings for food a little bit more controlled. However, when it comes to semaglutide, what you're trying to do is lose weight, right? If you're using it for that purpose. So by stimulating or overstimulating the pancreas to release more insulin and utilize the glucose that's already existing, and by blocking or inhibiting the release of glucose in the stored form from the muscles and liver, by inhibiting or blocking glucagon, well, now you create a deficit. And so, but it also creates a feeling of being satiated or full, because while your insulin keeps continuing to be stimulated to release from the pancreas, your body is going to think that you have enough sugar floating around. So that release of insulin and that utilization of all the existing glucose in the body is how you achieve the weight loss, because you're not utilizing a ton of what's stored, and you're just utilizing everything that's already present in the bloodstream, and then controlling the appetite by doing such. So semaglutide is a great medication for diabetic control, of course, but it's also a great medication for weight loss. Now, every medication has its pluses and minuses. So we can't just talk about the good side effect, which is weight loss, without talking about some of the negative side effects. Now, typically, what practitioners are seeing with the use of this medication first and foremost is nausea, just an intolerance to the medicine when you first started. And I'm going to go over how this medicine is first dosed and how it's titrated. Typically, this medication, when it's first introduced into the body in a subcutaneous form, meaning it's always injected subcutaneously right around the abdomen or the midsection. The dose that's used for the initial ramping, if you will, is a 0.25 milligram. And so that dose is typically given for about 2-week period of time. After that period of time, then the dose can be titrated up to 0.5 milligrams. And for most people, 0.5 is going to be the desired dosing to lose the amount of weight that most people will want to lose on average. And that can be anywhere from 15 to 30, 35 pounds, something like that. If you are seeking more, or you happen to be a person that just, is not responding to the medication, then you can actually upregulate the dose even further to as high as 1 milligram or even 1.25, and even higher than that. It all depends on the person. It depends on how your metabolism is regulated, how well it's controlled, whether you have other endocrine disorders, such as, of course, thyroid disease, which has a direct correlation to the efficacy of semaglutide. It seems as though some people who suffer with hypothyroidism or thyroiditis will have to increase their dose even further to get the achieved desired result. And that's just something that goes along with the systems, because basically what you're working on, what semaglutide is working on, is a negative feedback system with insulin and with glucagon. And these hormones, most of the hormones associated with the endocrine system, are all negative feedback. And so meaning that when your levels reach a certain point, then they return back to the hormone or the gland where they're being released or produced, and it tells that gland to shut down and stop releasing, that type of thing. So again, when you're initiating the dose, a lot of people for the first couple of weeks complain of nausea. That tends to be the most significant side effect. There are other side effects that are GI related, diarrhea, upset stomach, of course, loss of appetite, which is what you want, low energy, low fatigue. And then, of course, as you continue to take the medication, within about 2 weeks, the nausea tends to diminish, but other things start to occur. One being a depletion of your natural nutrient vitamin supply because you're just not eating as much food. The other thing to keep in mind is when you're on this medication, you need to stay well hydrated. So I try to counsel patients to drink a lot of water if they're going to be taking semaglutide. Beyond that, you really just want to focus on using some type of journal to write down all the food that you're consuming so that you can realize that, number one, you have to remind yourself to eat, because when your appetite is suppressed with something like semaglutide, your appetite tends to become very diminished, and so you don't eat as much, which is what you want, but you also can't be starving completely, because then you're going to deplete yourself of those vital nutrients and minerals that we just talked about a second ago. And those vital nutrients and minerals will affect the growth of hair, skin, nails, complexion, things like that, and your overall wellness and your overall energy levels. We don't want them to be diminished to the point where you're fatigued and you don't have energy to do anything. So one thing that is often offered with semaglutide is some type of IV infusion that would include vitamins like B12, for example. And so the key with taking semaglutide is just to remember that you want to stay hydrated and you want to journal the food that you're consuming so that you can remember what you're eating and how much. And then beyond that, you just want to consider that if you are getting depleted, you need to supplement that depletion with vitamins or whatever it is that you need. One thing to keep in mind, depending on how quickly you do end up losing weight, is try to focus on changing your lifestyle from consuming foods that are super rich in carbohydrates to foods that are more rich in protein. That will also help keep the appetite diminished, so that if you do choose to wean off or come down off the dose, it's not going to be an immediate ravenous increase in appetite, which is going to then increase your weight again. That's what you're trying to avoid. You want to try to make good lifestyle changes so that you can maintain the weight loss once it does occur. However, in some cases, depending on how much weight you lose and how much you want to maintain as far as weight lost, there are some people that will have to be on semaglutide, not necessarily on an infinite basis, but for quite a bit of time. It's really unknown how long at this point, but in many cases, people who have been on it, lost weight, and then decided to go off of it, end up regaining some of that weight. So there has to be a good balance between journaling the food you eat so that you know, okay, this is probably not the best choice. I can maybe change to something different, more healthy, eating higher protein, lower carb, staying active, of course. And that's where your nutrients to keep you energized are vital, because you need to stay active. You need to continue exercising, walking, cardio, whatever it is that you do for exercise. But at the end of the day, this medication is a good medication for weight loss. It is also a good medication for good diabetic control. But it is a medication that has to be taken with, of course, some considerations. Number one being that you don't want to ramp too high in dose, because it may cause such a diminished appetite that you just don't eat enough, and your weight loss will definitely be commensurate with that. But if you get to the point where you feel like you've lost either too much weight or you've lost the desired amount, and then you suddenly just go off, you may regain some weight, which is why it has to be a process. And semaglutide needs to be part of a lifestyle change, not just a miracle wonder drug to work. It is going to work for most people, but not everybody's going to get the same effects. So hopefully this information was useful. Hopefully you understand that if you're going to be taking semaglutide, you definitely want to do the right type of approach. You want to be a slow and steady, titrate up in a slow and steady fashion. And of course, journal the food that you're eating so that you can see what kind of changes you need to make to your lifestyle. Stay active, drink lots of fluids, high protein, low carbs, that type of thing. And at the end of the day, as long as you do those things wisely, you will see pretty significant weight loss, and you will be able to maintain that weight loss. So there again, if this information was helpful, please give this video a thumbs up. Subscribe if you haven't. There's a lot of you out there that watch the videos but aren't subscribed. Please subscribe. It'll help the channel grow a little bit faster. And like always, I appreciate all of your support. And on the next video, we'll get back into the cars. I'm going to be installing some more parts onto the Bronco. And so look for those videos coming up. Until then, this is Motors and Medicine signing off.